talking knee arthritis pain. Sources say that it's the most common elective surgeries, a knee replacement in the U.S. We have Dr. Beth with House Fit in the studio with us to talk about their treatments.
Yes, thanks so much for having me. So a lot of times people will come to us when they're looking for non-surgical management.
Yes.
Even though it's the most common surgery, we have so many clients who don't want to go under the knife and they're looking for other more natural approaches.
Yeah.
They've tried pain pills, they've tried injections, and they're still not getting the results they're looking for, and they're seeking out other options. And this is where something like regenerative therapy can come into play.
All right, so let's talk about what you guys do that's different. What are the different treatments?
Yeah, so at House Fit we offer EMTT, radial shockwave, and focused shockwave. We're the only clinic in the St. Louis area to offer all three, and it allows us to give a much more comprehensive approach without any kind of surgery intervention.
So I was reading a little bit up on this, and some of the things that you guys really target is inflammation, decreasing that, and then physical therapy.
Yeah, so oftentimes the reason why pain pills and injections don't work is they're not targeting the root cause of the pain, which is inflammation. So we know that when the bone on bone starts to rub, it creates friction, and it doesn't create just swelling in the joint, but in the bone itself, which is why pain pills and injections don't work. We're able to use regenerative therapies to push inflammation out of the joint, heal the damaged tissue, and even push the inflammation out of the bone, which is really the root cause of that dull, achy pain that just doesn't want to go away.
So I was telling you earlier, I have Osgood-Schlatter's disease, which means I have this calcium buildup,
Yes.
as you know. And my daughter, Hallie, she likes to hit it.
Oh, that's probably
Just
not
when she
very
wants-
comfortable.
No, hurts like
Hallie.
the Dickens. Yeah, but would this be something that would be benefit from such therapy?
Yeah, absolutely. So regenerative therapy can be used to treat any musculoskeletal pain. It can break up calcifications. It really is good for anything that hurts in the body.
So what are some of the signs that you may need some regenerative therapy, physical therapy, or just for it to be taken a look at?
Yeah, so anybody that's having pain that's not going away with traditional approaches, or if you're just not looking for pain pills and injections, that would be appropriate to do. Now, we talked about physical therapy as well, because the regenerative therapy is going to help settle the pain down, but it's not going to increase the muscle strength or get the joint moving again or return you back to function. And so that's why we're excited to be able to not only decrease the pain, but do the second part of the equation to get you full recovery, which is get you back to strength and moving.
What are some of the reactions that you get when you let them know, hey, there's some alternatives before we, get you under the knife? There's something that's for you.
Yeah, people are very hopeful and excited. And we've had people, one of our recent clients, Dick, he wasn't able to go up and down the stairs. He was actually crawling up and down them because his knee pain was so bad. He was not a surgical candidate, and now he's going up and down the stairs
Look
again.
at that.
So it's just so exciting to be able to give people their life back when they feel like all the other options have been exhausted.
Yeah, that's the key, is giving people their life back. When they get their mobility, when they can do what they wanted to do once again, boy, that's life-changing.
Absolutely.
If someone wants to learn more about House Fit,
Yes,
where
head
can they do
over
that?
to the website. We've just added 7 new pages talking specifically about regenerative therapy, and we also offer a free consultation. So
Nice.
if somebody's interested in finding out if this is a good fit for them, they can come on in for a free consultation, meet with one of their therapists, and find out if this is a good option.
Well, there you guys have it. House Fit. Go online, get some more information, and see what your options are. Thank you so much,
Thanks,
Dr.
Dr.
Beth.
Beth.
Thank you.
We'll have more in the Studio STO when we come back.